Starting off with a quote from Arvid Carlsson. Arvid Carlsson is a pharmacologist. He won the Nobel Prize for Medicine in 2000. But in the 1970s, he led the successful campaign against fluoridation in Sweden. This is what he wrote then. This is what he wrote in 2010. Sweden rejected fluoridation in the 1970s. Our children have not suffered greater tooth decay, and in turn, our citizens have not borne the other hazards fluoride may cause. In any case, since fluoride is readily available in toothpaste, you don't have to force it on people. Arvid Carlsson. So here's the first part. US government-funded brain studies should end fluoridation worldwide. This came out in September of 2017. It was published in the journal Environmental Health Perspectives, which is one of the leading environmental health journals in the United States. This was a 12-year, multi-million-dollar funded study, and it's striking which agencies funded it. The US National Institutes of Health, which is part of the National Institutes of Health, which promote fluoridation, the United States Department of Health and Human Services, the US National Institute of Environmental Health Sciences, which I think is one of the best scientific bodies in the United States, and also the US Environmental Protection Agency. In other words, it was funded by two agencies that have been very much involved in promoting fluoridation. And the authors came from many distinguished institutions, including Toronto, University of Toronto, Michigan, Indiana, McGill in Canada, Michigan again, Harvard, Mount Sinai, and Mexico City. And these researchers are highly qualified. Among them, they have produced over 50 papers which have examined the cognitive health of children as related to environmental exposures to other neurotoxic substances like lead and mercury. So these researchers knew what they were doing. And the study was very rigorous. The authors carefully controlled for many potential confounding factors, including exposure to lead and mercury, socioeconomic status, smoking, alcohol use, and health problems during pregnancy. Very rigorous. And here's our website announcing this study in September of 2017. Fluoride exposure in utero linked to lower IQ in kids, new study says. Well, here are the details of the study. They examined over 300 mother-offspring pairs. And as far as the mothers were concerned, they measured their fluoride exposure by measuring their urine fluoride levels. And the levels in the urine are important because they measure total exposure. It doesn't matter whether the woman is exposed to fluoridated salt, fluoridated water, fluoridated toothpaste, whatever the source of fluoride, it doesn't matter in this study. It's reflected, the level in the urine reflects total exposure, which is exactly what you need if you're going to compare communities with different sources of fluoride. As far as the children is concerned, they examined the IQ of those children at the age of 4 and again at ages between 6 and 12. And they're finding for every 1 milligram per liter increase in the mother's urine fluoride levels, the children lost an average of 5 to 6 IQ points. This is a very large and significant effect, which I shall be discussing more in detail later. Now, a 1 milligram liter difference in urine fluoride would be roughly the difference between living in a fluoridated area in the United States compared to a non-fluoridated area in the United States. So this study is very relevant to fluoridation in the United States and, of course, in New Zealand. Well, here's all their data. You see 300 data points here, mother-child pairs. On the left-hand axis, you have the IQ of the children, and down the bottom, the level of fluoride in the urine of the mothers. Now, you notice there's a very broad scatter of these data points, and some proponents of fluoridation have used that scatter to suggest that the contribution of fluoride is insignificant. Well, what you have to bear in mind is that there's a huge scatter of IQ based upon genetic difference. The genetic difference will explain a large amount of this scatter. And what we're looking at this curve is the influence that fluoride has on that scatter. If there was no influence from fluoride, then this would be a flat, straight line, a horizontal line. But that tilt is very significant. Now, Chris Neurath, our senior scientist at the Fluoride Action Network, has simplified this diagram to show that the range of fluoride levels in women in the United States would anticipate a loss of up to 6 IQ points. So the findings were highly statistically significant and were undiminished even after controlling for all those measured potential confounders. And for the testing at age 4, no lower threshold was found down to the lowest maternal urine fluoride levels, measured 0.2, down to 0.2 parts per million. There's no evidence of a threshold. Now, as far as relating this to New Zealand, the levels of fluoride in these women from Mexico City are almost identical to the fluoride levels made in Palmerston North, a study by Brow and others. Almost identical range of exposure in Palmerston North. And quite frankly, the range of exposure do not have to be identical. It just happens to be identical in the case of Palmerston. But just being in the same ballpark is a reason for concern. There is a copy of the abstract of this paper presented at a conference in New Zealand in 2015. So we could adjust Chris Neurath's graphs as follows with the same interval, essentially, that you have in New Zealand, the same fluoride interval that you have in New Zealand between the fluoridated women living in fluoridated communities versus non-fluoridated communities. So what was the American Dental Association, one of the leading promoters of fluoridation in the United States and worldwide, what was their response to this? Within a few minutes of the paper being published, they'd obviously got advance warning, the American Dental Association came out with a statement and said as follows: the ADA has examined a study in environmental health perspectives based on fluoride intake in Mexico and concludes the findings are not applicable to the United States. The ADA continues to endorse fluoridation of public water as the most effective public health measure to prevent tooth decay. Well, in a way, we've got used to these kind of statements from the ADA. I think they work backwards. Any study that finds harm is a junk study or not relevant, blah, blah, blah. They've always got a series of excuses. But what's interesting, in the same newspaper where this quote was published in Canada, this is the response from the lead investigator of that study, Dr. Howard Hugh from the University of Toronto. He says, "This is a very rigorous epidemiology study. You just can't deny it. It is directly related to whether fluoride is a risk for the neurodevelopment of children. To say it has no relevance to the folks in the United States seems disingenuous." Yes, indeed. So that brings